We've now got Tamás Dombos, who is the person who was chosen to present from the small pre-meeting that UNAIDS, EATG, AIDS Action Europe, and ILGA, I think that's it, got together in advance of this, specifically for LGBT activists from Hungary, Turkey, and Poland, three countries chosen because of their political situation, to talk about how you generate PrEP advocacy and also sexual health advocacy and work in countries where the political situation is not that friendly, put it that way. So Tamás is going to basically report from that meeting without slides, just being the rapporteur. Then we're going to have a short break. Okay, we don't actually have coffee, it's purely for comfort, and then we want to hear from you, and Harriet will facilitate that discussion. Tamás.
Well, thank you for giving the floor to me, and I apologize for not having very fancy presentation. Of course, this is a report from the last day of workshops that we had. So the idea of the workshop came out from the frustration with the general atmosphere in Europe that we have been winning the fight against HIV/AIDS. And that might be the case for Western Europe, but it is definitely not the case for other parts of Europe, namely Eastern Europe. The three countries were selected because of the similarity in the political and social environment in these countries, namely that these are countries that are already or are in the process of developing quite repressive regimes which have a very clear anti-LGBTQI focus in their political agenda. So we spent the first part of the day by analyzing the situation in these countries, trying to find the similarities and differences among the countries. The similarities were striking. We could find word-by-word campaigning coming from government politicians, talking about the LGBTQI communities with words such as sexual aberration, linking homosexuality to pedophilia, word by word borrowing among these countries. And not only just a few of the politicians talking, but a well-organized campaign in which you see more and more leading government politicians talking in this way, supported by a large network of pro-government media that do the background work and echo the same messages around. In some countries, for example, in Turkey, not just talking about pedophilia, but also linking LGBTQ organizations to terrorism and blaming them for being involved in that. Besides this targeted attack on the LGBTQI community, we see a shrinking space in these countries. We see a lack of funding for NGOs coming from the public sources, but also limitations put on a collection of private donations in the case of Turkey, or in the case of Hungary, restricting the reception of foreign funding, or at least stigmatizing the reception of foreign funding. We also find in many of these countries a disengagement of the LGBTQI community from the topic of HIV/AIDS. They're more focusing on kind of the political homophobia and not so much on the issue of HIV/AIDS, which of course then is a problem for the organizations that would like to focus on HIV/AIDS but don't have the community support. But there are also striking differences among the countries. In Hungary, for example, the legal system and legal protections are still in place, so that was something that many activists could rely on. And while there are countries which, at least on paper, try to be nice about HIV/AIDS, having strategies and treatment guidelines, while countries such as Hungary gave up on that. So we have no HIV strategy for nearly 10 years, and we have no guidelines on treatment adopted. So after mapping the situation, we went into, okay, this sounds very bad, but do we see any promising signs, any promising practices that might be used? So this was difficult, but we tried to come up with at least some suggestions on what might work. In countries where there is some legal protection still in place and there are enforcement mechanisms, litigation might work. So we saw in the case of Hungary how litigating against a clinic that was not serving people living with HIV led into the complete restructuring of the HIV treatment structure, as well as an issuing of a protocol for all healthcare providers about treating people living with HIV on a non-discriminatory basis. We also saw that in case where you don't have the funding and you can't do the fancy campaign campaigns, there might be community efforts to do campaigning around sexual health and HIV awareness, and we use the example of Poland and the U=U campaign, or the individual. We also saw in some cases where, even though the central government might be anti-LGBTQI or homophobic and transphobic, you might find political allies in opposition parties, for example, on the municipal or regional level, that you can leverage this support. So these were the best practices, and then we went into discussing three core questions. That is the question of funding, of community engagement, and data reliability. And then we went into smaller groups to discuss the challenges and come up with activities to do in those fields. So with the funding, the difficulty that many of these Eastern and Central European countries find is that they are either already in the EU, or at least perceived to be middle-income countries, not in need of foreign donations. So many of the Western European aid-giving countries are not targeting these countries. The local government, the national governments are not giving money. So we do see a crisis in funding for HIV/AIDS work. How to deal with that? We started mapping the potential donors, and we will continue that, and also to work with, on an international level, advocacy on the international level, to try to convince the donors to actually focus on this region and not leave people behind in this respect. The community engagement subgroup focused on the importance of dialogue between HIV activists, HIV organizations, medical professionals, and the LGBTQI community. It was a long discussion whether linking the question of HIV and LGBTQI is a good tool communicationally or politically, but in practice it must be there. We cannot decouple these two topics since the community affected is largely MSM and trans women. So the practical link is there, but how to deal with it on the communicational level, that's a bit different. So we emphasize the importance of dialogue among these actors, even if the topic is discussed as a health topic, not so much as an LGBTQI topic. And finally, the importance of using easy to understand communication tools in which people that are a bit fed up with negative messaging around HIV/AIDS might be still listening to and taking this topic seriously. And finally, the data reliability, the difficulty in convincing the international donors and international organizations about the situation in these countries is that the data that is produced is not reliable. So they can claim that there is no problem happening. So we discussed how better surveillance coming from NGOs and civil society might be there to complement or give a different picture than the official data collected and published. So you might, you in the group might question, okay, what is the relevance of all this work for me? Well, unfortunately, what we see, this kind of discourse and political strategy that started in some of the countries is really contagious. Not dissimilarly from the infection that we're talking about. While we have PrEP for and treatment stopping HIV, we have not yet found the solution of how to stop the contagiousness of this political homophobia and transphobia. What we see is that there is a clear trend of more and more countries jumping on this bandwagon of scapegoating the LGBTQI community, which then, of course, makes the work of organizations, but also the life of LGBTQI people very difficult in these countries. So we thought, what would be a crucial tool for all of us to focus on, and that the notion that we came up with was solidarity. Solidarity among the key populations, solidarity among NGOs working on the national and international level, as well as solidarity internationally. Countries that have solved the HIV crisis should also devote their resources and attention to countries that are still struggling with this. To carry on the work, we have agreed to establish a task force that will continue on the items that we agreed on, the donor mapping, the international advocacy for the restructuring of international aid, as well as continuing with data reliability and community engagement and coming up with practical tools for these groups working on the grassroots level. Thank you.
Do we have any questions from the floor for Tamás? Oh yes, join us here again. I've got 13 jobs today.
Just really quickly, thank you for that. Is there going to be a report, and when?
Yeah, okay. Yes, there is going to be a short report about the workshop. When it comes to timeline, I'm not sure, a few weeks, I guess.
Thank you. Just Yanis, anything at the back? No? Any more questions? I don't see any hands. Okay. Thank you very much. Round of applause.